Border zones are areas where a lot of different changes take place, political, economic, social, and differences between the two countries that border. And at the U.S.-Mexico border, it's particularly important because in the last 5-10 years, violence due to different factors, especially drug trafficking, has become a concern for public officials, for private entities, and for everyone, because it has created anxiety and fear among the population, which has adverse effects on people's health, on immunization coverages, on food security, etc. So it's important to build awareness around the need to have strategies to prevent violence and to ensure human security, especially in border areas. Well, the concept of human security has been developing in the last decades. At the end of the 90s, the United Nations Program on Development prepared a report on human development. And in this report, the discussion went from the issue of human security as a concept of national security, where militarization and police force were the strategies that were most used in terms of preventing violence or dealing with conflict among nations or internal conflicts. As of that Human Development Report in 1994, the UN system and all the agencies began to look at the issue of human security in a different concept. Human security in terms of ensuring that communities where people live, work, and play, and communities and nations would have the conditions so that people would not live in fear of aggression, fear of food insecurity, fear of not being able to speak on one's behalf or to participate in democratic activities, elections, etc. PAHO in 2010 brought forth a resolution to our governing bodies on health and human security, which brings a commitment from the organization, the Secretariat, and the countries to disseminate this broader concept of human security, and also to work closely with public sector, private sector, and governments to ensure that the conditions of development at community level and human development for people are the greater focus of our work, and that and disseminate the evidence that violence cannot be dealt with solely with police force or military force. Well, the prevention of violence and injury has a lot of evidence accumulated in the last decade or so. WHO prepared the report which identifies the root causes of violence, but especially presents the challenge of implementing violence prevention with the public health approach, or focus on public health, and using also the ecological model. So with the public health approach, the challenge is to have the evidence to base policy decisions, programmatic decisions, and also to know what are the more effective strategies and programs and policies, so that they can be extended, or scaled up beyond a demonstrative project or a pilot project. So those are major challenges because it requires a shift in policy and a shift in budgets sometimes. The evidence comes from using exactly the public health approach because it begins to identify the problem and the causes and the risk factors. And once those are identified, then strategies can be also identified and implemented that would deal with those root causes and not just the symptoms of violence, which is probably what the more police and military strategies deal with. So the root causes would be poverty, inequity, the lack of opportunities, especially for young people, beyond education and work, and ensuring conditions where people live and work and play that would support a dignity in their lives. The evidence also shows that you need to look at the different aspects of both the problem and the solution. So using the ecological model, you can identify at the individual level, at the family level, at the school, workplace, community, and society level, what are the key risk factors and the root causes of violence and injuries, and thus select the more effective strategies in those different levels. So the evidence shows that you can prevent violence, that you can help countries and communities establish conditions whereby people can live with human security without fear of violence, of aggression, of fear, lack of food, and what have you. It covers several aspects. It covers aspects that have to do with that public health approach. For instance, there are articles on the evidence on the surveillance, on research, on the Observatory of Citizen Security and Conviviality of Ciudad Juarez, where it shows not only the importance of having the evidence, but also of bringing together those agencies and the departments, the city government departments and the health department and other agencies that each have a piece of that data, because the data is distributed in different agencies. So bringing them together and making sure that they understand the different perspectives that data reflects, and also the opportunity to have them implement policies and programs, because they're the agencies that have the mandate and the responsibility to implement policies and programs. So that first part of gathering the evidence of research and surveillance is very well covered in the articles presented. It also presents articles from different parts of the border and from different countries. It shows, for instance, the importance of working with the media and how influential the media can be in the way they portray the events of violence, how they report homicides and different injuries, and how that affects people, especially children, and how you can work with the media to report the information, because it's important to report the information, but do it in such a way that it doesn't have a further impact or a further violent impact on the population. There are other articles that show how different communities and different countries have implemented strategies to prevent violence and injuries. And this will be important because sharing that information helps people implement more evidence-based practice.